Hi class, my name is Kaylee Choa and I did my infomercial on breast cancer awareness. So I'm going to begin with what is breast cancer. Breast cancer is a disease in which cells in the breast grow out of control. A breast is made up of three main parts: lobules, ducts, and connective tissue. The lobules are the glands that produce milk, and the ducts are the tubes that carry milk to the nipple. The connective tissue, which consists of fibrous and fatty tissues, surrounds and holds everything together. Most breast cancers begin in the ducts or the lobules. So continuing on with what is breast cancer. When breast cancer spreads to other parts of the body, it is said to have metastasized. The two most common types of breast cancer are invasive ductal carcinoma, in which the cancer cells grow outside of the ducts into other parts of the breast tissue. Invasive cancer cells can also spread or metastasize to other parts of the body. The second is invasive lobule carcinoma. Cancer cells spread from the lobules to the breast tissue that are close by. These invasive cancer cells can also spread to other parts of the body. Next, I will be discussing the risk factors for breast cancer. There are many risk factors for breast cancer that cannot be changed. The main factors that influence your risk include being a woman and getting older. Most breast cancers are found in women who are 50 years old or older. Reproductive history. Early menstrual periods before the age of 12 and starting menopause after the age of 55 expose women to hormones longer, which raises their risk of getting breast cancer. Having dense breasts. Dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to see tumors on a mammogram. Women with dense breasts are most likely to get breast cancer. Family history of breast cancer. A woman's risk for breast cancer is higher if she is has a mother, sister, or daughter, a first-degree relative, or multiple family members on either her mother's or father's side of the family who have had breast cancer. Having a first-degree male relative with breast cancer also raises a woman's risk. Next, I'll be talking about some risk factors for breast cancer that can be changed. So, not being physically active. Women who are not physically active have a higher risk of getting breast cancer. Next, being overweight or obese after menopause. Older women who are overweight or obese have a higher risk of getting breast cancer than those at a normal weight. More risk factors for breast cancer include taking hormones. Some forms of hormone replacement therapy, those that include both estrogen and progesterone, taken during menopause can raise risk for breast cancer when taken for more than 5 years. Certain oral contraceptives, such as birth control, have also been linked to raise breast cancer risk. Reproductive history. Having the first pregnancy after age 30, not breastfeeding, and never having a full-term pregnancy can raise breast cancer risk as well. Finally, drinking alcohol. Studies show that women's risk for breast cancer increases with the more alcohol she drinks. Next, I will be talking about early symptoms of breast cancer. Skin changes such as swelling, redness, or other visible differences in one or more breasts. An increase in size or change in shape of the breasts. Changes in the appearance of one or both nipples. Nipple discharge other than breast milk. General pain in or on any part of the breast. And lumps or nodes felt on or inside of the breast. Next, I will be talking about the invasive breast cancer symptoms. They include a lump or mass in the breast, swelling of all or part of the breast even if no lump is felt, skin irritation or dimpling, breast or nipple pain, nipple retraction, which means turning inward. The nipple or breast skin appears red, scaly, or thickened, nipple discharge, or a lump or swelling in the underarm lymph nodes. Next, I will be talking about breast cancer treatment. Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far it has spread. People with breast cancer often get more than one kind of treatment. Surgery is an operation where doctors cut out cancer tissue. Chemotherapy, which uses special medicines to shrink or kill the cancer cells. The drugs can be pills that you take or medicine given to you in your veins, or sometimes both. Hormonal therapy, which blocks cancer cells from getting the hormones that they need to grow. Biological therapy, which works with your body's immune system to help it fight cancer cells or to control side effects from other cancer treatments. And finally, radiation therapy, which uses high-energy rays similar to X-rays to kill the cancer cells. Finally, I'll be talking about who breast cancer affects. All women should be aware of the risk of breast cancer. It can affect women of every age, race, and ethnic group. According to the National Cancer Institute, white non-Hispanic women have the highest overall incidence rate for breast cancer among U.S. racial and ethnic groups, while Korean American women have the lowest rate. Among women ages 40 to 50, African American women have a higher incidence of breast cancer than white women. African American women also have the highest mortality death rate from breast cancer, while Chinese American women have the lowest death rate. Studies show that African American women tend to seek treatment when their cancer is in a more advanced and less treatable stage. In addition, a higher percentage of African Americans and Hispanics lack a usual source of health care, which as a primary care provider.